Hello everyone. Our today's topic is about medical emergencies. Before that, you should know about the ASA classification. Uh, the class 1 is that means the person is healthy with no major illness. The class 2 shows the mild health, uh, the patient with a mild health disease but still can do regular activities without any restriction. The class 3 is the patient with the severe health issues. The individual he has severe health problems that limit their normal activities. And class 4, it's the life threatening issues. The person who has a critical health conditions that affect their daily life and are potentially life threatening. And class 5, remember, it's terminal condition. So that is for someone who is in very bad state and it is not expected to survive without the medical intervention. Now let us discuss what are the various medical emergencies. So common medical conditions that leads to emergency, they can be either cardiovascular. So in cardiovascular systems, conditions like angina or the coronary artery disease, coronary artery occlusion, heart failure, MI, arrhythmias, hypertension, shock. Other can be respiratory emergencies. The respiratory emergencies could be asthma, emphysema, respiratory distress. The nervous system disorders could be epilepsy, syncope, etc. The metabolic diseases like the diabetes, cholinesterase inactivity, endocrine malfunctions like the hypothyroidism, hyperthyroidism. So these are considered. So these are the most common emergencies that could be. These are the syncope, seizures, trauma, asthmatic attacks, chest pain, drug toxicity, airway obstruction, allergies, or hypoglycemia. So we will discuss them one by one. The first is let us discuss first the cardiovascular emergencies. Here the first comes the angina pectoris. So in angina pectoris, the patient would feel sudden onset of pain. The pain, it can be either a localized or it can be radiating. So remember, the most common feature, the important feature is the substernal distress or substernal discomfort. So what would the patient feel? The patient would feel like feeling of fullness or the pressure. So why do angina pectoris occur? It is because of result of the myocardial ischemia, that is caused by imbalance between the myocardial blood supply and the oxygen demand. So remember, the angina pectoris, it is a medical condition that is characterized of the patient feel chest pain or discomfort that occurs when the heart muscle does not receive enough blood and oxygen. So it can be due to the result of coronary artery disease, where the blood vessels supplying the heart, they become narrow or blocked, that lead to the reduced blood flow. Now when the patient with angina pectoris, it comes to the clinic for the dental extraction while sitting on the dental chair, the main factor here would be the stress and the anxiety that is associated with the procedure. So that will trigger or exacerbate the angina symptoms. So there could be increased heart rate, increased blood pressure during the dental extraction, and may lead to imbalance between the heart oxygen demand and its supply. So that would cause a severe chest pain. So it can be typically angina, it is precipitated by exertion, eating, exposure to cold or due to any emotional stress. So the pain, it lasts for around 1 to 5 minutes, and how it is relieved, it can be relieved either by the rest or by sublingual glyceryl trinitrate. You just put it under the tongue and it will give you relief. So before the dental procedure, what you have to do is you need to collect a detailed medical history, including the information about the patient cardiovascular health. You should know the severity of the angina, their triggers, etc. So your main goal is to reduce the patient anxiety, to minimize the anxiety during the dental procedure, as stress, it can contribute to the angina. So ensure the patient has taken any prescribed medication like the glyceryl trinitrate or the nitroglycerin. So apart from that, while during the procedure, you should monitor the vital sign like the heart rate, blood pressure, oxygen saturation, and so these are the important vital signs that you need to administer, that you need to regularly check out. Apart from that, be prepared to initiate basic life support measures if required. Now, how can you recognize the symptom? Identify the sign of symptom of angina, including the central chest discomfort. Either pain is radiating to the neck, arms, jaw, etc. Look for additional symptoms like patient feeling pallor or sweats, or there could be shortness of breath, or there could be change in heart rate. It can either slow down or get a faster rate. So immediate you have to stop the procedure. The patient position, sit the patient up if it is a dyspneic, and you have to give the oxygen. So if symptoms continue for more than 10 minutes and if they are not relieved, you can give glyceryl trinitrate. So you have to promptly give the nitroglycerin 400, the dose is 400 micrograms. It can be given as a spray, or it can be given as a form of sublingual tablet. Apart from that, you have to continue check the patient symptoms. So if the patient symptom persist or worsen after 5 minutes, you can give additional glyceryl trinitrate. The other condition can be either is the coronary artery occlusion. So that means when there is blockage or there is narrowing of one or the more coronary arteries, the blood vessel that supply the oxygen and nutrients to the heart muscle. So that blockage can result from the build of the plaque. That condition is known as atherosclerosis, or you can see the formation of blood clot that can reduce the blood flow to the heart. So when coronary artery become completely blocked, that can result in a heart attack or myocardial infarction. The myocardial infarction, remember, it is also known as heart attack. It occurs when there is irreversible necrosis of the heart muscle due to the prolonged ischemia. So due to the lack of blood flow and the oxygen, myocardial infarction can occur. So when there is imbalance between oxygen supply and demand to the heart muscle, And when this imbalance is severe and sustained, that can lead to damage or death of the heart. So in context of the dental extraction in dental chair, the stress, the anxiety, the physical exertion that is associated with the procedure, it can trigger or worsen the myocardial infarction. Now, what are the sign symptoms of MI? You can see is the severe chest pain. The pain can radiate to arm, usually the left arm, neck or the jaw. The patient may feel shortness of breath or fainting. So you have to recognize the sign and symptom of MI, particularly the severe chest pain or discomfort. Stop the dental extraction. Call emergency medical services for immediate assistance. So you can here give is the aspirin, as it can reduce the clot formation. Apart from that, you can monitor the vital sign, heart rate, PP and oxygen saturation level. Be prepared to initiate the basic life support if they are necessary. Apart from that, defibrillation can be done. So if the patient he becomes unresponsive and does not have any pulse, automated external defibrillation may be required. Other condition, that is the shock. Shock, it occurs when there is inadequate supply of blood and oxygen to the body tissues and organ. There are various type of shocks, including hypovolemic shock, cardiogenic shock that is related to the heart failure, septic shock that could be due to the severe infection, and the neurogenic shock that is due to the nervous tissue dysfunction. So the sign and symptom of shock, there would be weak pulse, low blood pressure, cold clammy skin. So you have to place the position in semi-reclining supine position with the legs and thorax slightly elevated. Give oxygen with the face mask to improve the oxygenation. Apart from that, you can give is the IV fluids. If the hypotension it occurs and the skin it is cold clammy, you can give the IV infusion of 5% dextrose in water, or you can give is the Ringer lactate solution to restore the blood volume. So apart from that, you can use is the vasoconstrictor like the phenylephrine to elevate the blood pressure. Now other are the respiratory condition. The first is the asthma. We know asthma, it is a chronic inflammatory disease of the airway. So that is characterized by bronchospasm, and there is increase in overproduction of thick mucus that leads to symptoms like coughing, difficulty in breathing, wheezing. So the condition is marked by airway that are hyper responsive. So the asthmatic attack can be triggered by exposure to allergens, exercise, respiratory infection, or the emotional factors. So remember, the attack usually occur at the night, but it may follow exposure to allergens, exercise, emotional upset or excitement. So let us discuss about the management. You have to ask the patient to bring their asthma medication or the inhaler to the dental appointment. So that is must. Minimize the stress during the dental appointments to avoid the triggering the asthmatic attack. Nitrous oxide, it is recommended for sedation in the stressed asthmatic patient as it has no respiratory depressing properties. So if the oral sedative, they are required, low dose acting benzodiazepine that could be given. The stress has to be relieved. Nitrous oxide, remember, it is an recommended sedative in stressed asthmatic patient as it has no depressing properties. Apart from that, low dose short acting benzodiazepine like the diazepam, it may be given. You can use is the plain local anesthesia without using any vasoconstrictors like the epinephrine in a severe asthmatic patient, as these vasoconstrictors they may contain sulfite, so they could precipitate the asthmatic attack. Asthmatic patients who are on long-term systemic steroid may require supplement dose of their medication for major surgeries. Now remember, acute asthmatic attack require immediate therapy, fast-acting bronchodilator that should be provided immediately. So in severe asthmatic patients who are not responsive, you can give a subcutaneous epinephrine. Apart from that, sportive measures include oxygen therapy and repeating the inhaler after every 20 minutes. So what is the algorithm for the management of asthmatic attack? So if there are signs and symptoms like dyspnea, wheeze, cough and sputum, and these are severe, so you have to make the patient sit up and loosen the tight clothing. So sit the patient up, loosen the tightened clothing, evaluate the severity of attack, identify the life-threatening signs like the silent chest on osculation, cyanosis, sweating, bradycardia, hypotension. Apart from that, you can give is high flow oxygen, salbutamol inhaler with the volumetric spacer that can be given. So you have to give one puff and allow 6 breath. So repeat every minute for 5 minutes until the symptoms they would improve. So if no improvement occur, call the emergency services and repeat spaced salbutamol. Apart from that, you can consider is the hydrocortisone that can be given either intramuscularly or intravenously. Other condition is the respiratory condition is the emphysema. So emphysema, that is a chronic respiratory disease that fall under the broader category of chronic obstructive pulmonary disease. So there would be gradual destruction of the air sac, that are the alveoli that are present in the lung. So that lead to abnormal dilation of the air spaces and they may damage the lung tissue. So due to that, there would be decrease in the elasticity of lung. So due to that, there would be impaired airflow. So the impaired airflow would make difficult for the individual with emphysema to breathe. So it has the same asthma-like attacks that are triggered by the coughing spells. So you can use the bronchodilators, spray with the epinephrine for effective relief. The patient, they are generally scheduled an afternoon appointment to allow time for clearing the tracheobronchial tree. Other important is the mechanical or respiratory embarrassment that is due to the management of the foreign body in the airway. So when the foreign body it becomes lodged in the larynx, trachea or tracheobronchial tree, prompt and immediate intervention is important. Pharyngeal retrieval attempt. So suppose attempt to relieve the foreign body when it is still in the pharynx. So you have to instruct the patient to hold the mouth open, refrain from swelling or taking the deep breath. So you can use a long curved Kelly forceps, or you can induce the patient to cough forcefully that may expel the object. Laryngospasm and partial obstruction. If the foreign body it is impacted in the glottal opening, it may lead to coughing and choking spasm that may cause partial laryngospasm. So if the patient he can breathe with sufficient volume for the partial oxygenation but cannot dislodge the object, transport the patient to nearest hospital immediately. However, when the obstruction significantly reduces the ventilation, you can consider is cricothyrotomy. You can perform is cricothyrotomy that involves passage of the needle through the cricothyroid membrane in the midline. So this maneuver, it is important when the obstruction is at the level of vocal cord and superior to cricothyroid cartilage. The last is when the foreign body is in the bronchus. So if the foreign body pass into the right or left main bronchus, severe coughing or bronchospasm may occur. So inform the patient of the situation and take them to the hospital for the chest X-ray to confirm the location of the foreign body. Now moving to the central nervous system management. The first is the epilepsy. Epilepsy, we know it's a neurological disorder that is characterized by recurrent spontaneous seizures. So what is seizure? Remember, seizure, it is a sudden surge of electrical activity in the brain that can affect a person's consciousness, movement and sensation. So patient with epilepsy may experience seizure during or after the dental procedure, including the tooth extraction. So the main factors are the anxiety, stress, or lightening or pain that is associated with the dental procedure that can trigger the seizures. Now the seizures, they can be partial seizures, simple partial seizures, or they can be complex partial seizers, generalized seizers, absence seizers that are also known as petit mal seizures that are seen in the children's. Remember, for your MCQ point of view, the petit mal seizures, they are seen in the children's. Other are the tonic-clonic seizures that are also known as grand mal epilepsy. So here you will see the loss of consciousness, muscle rigidity and convulsions. So there would be tonic phase and clonic phase. Other can be myoclonic seizures that are quick jerky movement of muscle that can affect specific muscle or the entire body. Other are the atonic seizures. So here there would be loss of muscle tone that would cause sudden fall or the dropping of the head. So what are the treatment for the so maintain a patent airway, ensure adequate breathing, prevent the bodily injury during the convulsion, remove any dangerous objects from the mouth and around the patient. So turn the position to lateral recovery position. So if there is recovery in the less than 5 minutes, then discharge the patient. If there is no recovery, then consider as a status epilepticus, administer oxygen or diazepam can be given, or midazolam given buccally or by the nasal spray. These are the dosages. So diazepam 10 milligram IV over 2 minutes, or midazolam buccally or nasal spray that can be given for the adults or children. The next is the syncope. Syncope, we know it's also known as fainting or unconsciousness that is characterized by sudden and temporary loss of the consciousness. The predisposing factor can be stress, impaired physical condition, and the hypoglycemia. So remember the mnemonic vessels. V stand for vasovagal cause, electrolyte abnormality, that is hypercalcemia, situational subclavian steal syndrome, ENT cause. So these, it is the mnemonic to remember the causes of vascular and other causes of the syncope. Now the symptoms of syncope include dilated pupils, bradycardia, weak 30 pulse, and loss of the consciousness. So other is the vasodepressor syndrome, syncope. In the vasodepressor syncope, the stress that would lead to tachycardia, so that would stimulate the carotid body and the carotid sinus. So the vagal stimulation then causes a bradycardia and vasodilation, so that results in decreased blood flow to the cerebral, and that would cause cerebral syncope. So what is the management? Remember, the management of the syncope is you have to position the patient in this Trendelenburg position, that is placing the patient in a supine position with the brain and heart at same level, and the feet they are elevated at slightly 10 to 15 degree. That would increase the circulation to the brain. Apart from that, you can give is aromatic ammonia, that would stimulate the respiratory center, atropine to counteract the bradycardia. So that could be the treatment choice. The next is the acute adrenal insufficiency. Acute adrenal insufficiency, that is also known as Adansonian crisis, that can lead to syncope due to lack of adrenaline response. So this condition is associated with sudden and severe deficiency of the cortisol and aldosterone that are produced by the adrenal glands. So the patient with Addison disease will have impaired adrenal function, so that can cause a decline in the hormone level that would trigger acute crisis. So stress, remember, that can be either due to the physiological stress, emotional stress, that can increase the body demand for the cortisol. Other cause is patient who have undergone bilateral adrenalectomy, that is lost both the adrenal glands, that would cause a complete absence of cortisol and aldosterone production, that may make them more prone to the acute adrenal crisis. Apart from that, physical trauma, blood clots, tumor that are affecting the adrenal glands can disrupt the hormone production. Other is the hypoglycemia. Hypoglycemia refer to the low blood glucose level, and it can have a significant on the so we know that hypoglycemia would affect the mental and cognitive functions. So symptoms, it includes confusion, irritability, sweatness, loss of consciousness. Common cause is the diabetic mellitus, the most common cause of hypoglycemia, when there is imbalance between the administered insulin or the hypoglycemic drug and the body actual need. Treatment, the acute adrenal insufficiency, we can give is administration of IV glucocorticosteroids, hydrocortisone to replace the deficient cortisol. So in severe cases, mineralocorticosteroids, mineralocorticoids may be given to address the aldosterone deficiency. For the hypoglycemia, the treatment include the rapid ingestion of carbohydrate source. What could be that? That could be either glucose tablet, sugarcane, etc., glucose syrup, etc. For individual with a diabetic, adjusting the insulin or the oral hypoglycemic medication, and a constant meal schedule that can also prevent the hypoglycemic episodes. So these are all about the medical emergencies.